Breast cancer is the most common cancer in women in the United States. According to the American Cancer Society, it's estimated that about 178,480 women in the United States will be found to have invasive breast cancer in 2007. About 40,460 women will die from the disease this year. Right now there are slightly over 2 million women living in the United States who have been treated for breast cancer. If you're worried about developing breast cancer, or if you know someone who has been diagnosed with the disease, one way to deal with your concerns is to get as much information as possible. In this section you'll find important background information about what breast cancer is and how it develops. Breast cancer is a malignant tumor that grows in one or both of the breasts. Breast cancer usually develops in the ducts or lobules, also known as the milk-producing areas of the breast. Breast cancer is the second leading cause of cancer death in women after lung cancer. Although African American women have a slightly lower incidence of breast cancer after age 40 than Caucasian women, they have a slightly higher incidence rate of breast cancer before age 40. However, African American women are more likely to die from breast cancer at every age. Breast cancer is much less common in males. By comparison, the disease is about 100 times more common among women. The American Cancer Society estimates that in 2007 some 2,013 new cases of invasive breast cancer will be diagnosed among men in the United States. Types of breast cancer. There are several different types of breast cancer that can be divided into two main categories: non-invasive cancers and invasive cancers. Non-invasive cancer may also be called carcinoma in situ. Non-invasive breast cancers are confined to the ducts or lobules, and they do not spread to surrounding tissues. The two types of non-invasive breast cancers are ductal carcinoma in situ referred to as DCIS, and lobular carcinoma in situ referred to as LCIS. It is known that hormones in a woman's body, such as estrogen and progesterone, can play a role in the development of breast cancer. In breast cancer, estrogen causes a doubling of cancer cells every 36 hours. The growing tumor needs to increase its blood supply to provide food and oxygen. Progesterone seems to cause stromal cells, the woman's own cells, to send out signals for more blood supply to feed the tumor. Source: Dr. V. Craig Jordan, Vice President and Scientific Director for the Medical Science Division at Fox Chase Cancer Center in Philadelphia, as quoted in NY Times. Hormones and Cancer by Gina Colada, published December 26, 2006. Non-invasive breast cancer. The majority of non-invasive breast cancers are DCIS. In DCIS, the cancer cells are found only in the milk duct of the breast. If DCIS is not treated, it may progress to invasive cancer. In LCIS, the abnormal cells are found only in the lobules of the breast. Unlike DCIS, LCIS is not considered to be a cancer. It is more like a warning sign of increased risk of developing an invasive breast cancer in the same or opposite breast. While LCIS is a risk factor for invasive cancer, it doesn't actually develop into invasive breast cancer in many women. Invasive breast cancer. Invasive or infiltrating breast cancers penetrate through normal breast tissue such as the ducts and lobules and invade surrounding areas. They are more serious than non-invasive cancers because they can spread to other parts of the body, such as the bones, liver, lungs, and brain. There are several kinds of invasive breast cancers. The most common type is invasive ductal carcinoma, which appears in the ducts and accounts for about 80% of all breast cancer cases. There are differences in the various types of invasive breast cancer, but the treatment options are similar for all of them. Not all breast cancers are alike. Not all breast cancers are alike. There are different stages of breast cancer based on the size of the tumor and whether the cancer has spread. For doctor and patient, knowing the stage of breast cancer is the most important factor in choosing among treatment options. Doctors use a physical exam, biopsy, and other tests to determine breast cancer stage. Stages of breast cancer. The most common system used to describe the stages of breast cancer is the AJCC/TNM American Joint Committee on Cancer/Tumor Nodes Metastases system. The system takes into account the tumor size and spread, whether the cancer has spread to lymph nodes, and whether it has spread to distant organs metastasis. All of this information is then combined in a process called stage grouping. The stage is expressed as a Roman numeral. After stage 0 carcinoma in situ, the other stages are I through IV 1 to 4. Some of the stages are further subdivided using the letters A, B, and C in general. The lower the number, the less the cancer has spread. A higher number, such as stage IV4, means a more advanced cancer. These are the stages of breast cancer. Stage 0 is carcinoma in situ, early stage cancer that is confined to the ducts. or the lobules, depending on where it started. It has not gone into the tissues in the breast, nor spread to other organs in the body. Ductal carcinoma in situ DCIS. This is the most common type of non-invasive breast cancer when abnormal cells are in the lining of a duct. DCIS is also called intraductal carcinoma. DCIS sometimes becomes invasive cancer if not treated. Lobular carcinoma in situ LCIS. This condition begins in the milk-making glands but does not go through the wall of the lobules. LCIS seldom becomes invasive cancer. However, having LCIS in one breast increases the risk of cancer for both breasts. Stage I is an early stage of invasive breast cancer. In stage I, cancer cells have not spread beyond the breast, and the tumor is no more than 2 centimeters 3/4 of an inch across. Stage I is one of the following. The tumor in the breast is no more than 2 centimeters 3/4 of an inch across. The cancer has spread to the lymph nodes under the arm. The tumor is between 2 and 5 centimeters 3/4 of an inch to 2 inches. The cancer may have spread to the lymph nodes under the arm. The tumor is larger than 5 centimeters 2 inches. The cancer has not spread to the lymph nodes under the arm. Stage the third of may be a large tumor, but the cancer has not spread beyond the breast and nearby lymph nodes. It is locally advanced cancer. Stage 3A is one of the following. The tumor in the breast is smaller than 5 centimeters 2 inches. The cancer has spread to underarm lymph nodes that are attached to each other or to other structures. The tumor is more than 5 centimeters across. The cancer has spread to the underarm lymph nodes. Stage 3B is one of the following. The tumor has grown into the chest wall or the skin of the breast. The cancer has spread to lymph nodes behind the breastbone. Inflammatory breast cancer is a rare type of stage IIIB breast cancer. The breast looks red and swollen because cancer cells block the lymph vessels in the skin of the breast. Stage 3C is a tumor of any size. It has spread in one of the following ways. The cancer has spread to the lymph nodes behind the breastbone and under the arm. The cancer has spread to the lymph nodes under or above the collarbone. Stage IV is distant metastatic cancer. The cancer has spread to other parts of the body. Recurrent cancer. Recurrent cancer is cancer that has come back or recurred after a period of time when it could not be detected. It may recur locally in the breast or chest wall as another primary cancer, or it may recur in any other part of the body, such as the bone, liver, or lungs, which is generally referred to as metastatic cancer. The 5 steps of a breast self-exam. Step 1. Begin by looking at your breast in the mirror with your shoulders straight and your arms on your hips. Here's what you should look for. Breasts that are their usual size, shape, and color. Breasts that are evenly shaped without visible distortion or swelling. If you see any of the following changes, bring them to your doctor's attention. Dimpling, puckering, or bulging of the skin. A nipple that has changed position, or an inverted nipple pushed inward instead of sticking out. Redness, soreness, rash, or swelling. Step 2. Now, raise your arms and look for the same changes. Step 3. While you're at the mirror, gently squeeze each nipple between your finger and thumb and check for nipple discharge. This could be a milky or yellow fluid or blood. Step 4. Next, feel your breasts while lying down, using your right hand to feel your left breast, and then your left hand to feel your right breast. Use a firm, smooth touch with the first few fingers of your hand, keeping the fingers flat and together. Cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. You can also move your fingers up and down vertically, in rows, as if you were mowing a lawn. Be sure to feel all the breast tissue just beneath your skin with a soft touch, and down deeper with a firmer touch. Begin examining each area with a very soft touch, and then increase pressure so that you can feel the deeper tissue, down to your rib cage. Step 5. Finally, feel your breasts while you are standing or sitting. Many women find that the easiest way to feel their breasts is when their skin is wet and slippery, so they like to do the step in the shower. Cover your entire breast using the same hand movements described in Step 4.